Complex PTSD or cPTSD is a relatively new diagnosis. However, sadly, it is quite a common presentation, and what makes things even harder is that there is little evidence base around the treatment of cPTSD. What I hope to do in this video is touch on what the research or science tells us should be the treatment for cPTSD. My name is Joseph. I'm a psychiatrist working at Epsychiatry, a telehealth mental health service provider here in Australia. There are timestamps here if you would like to skip ahead. In today's video, I'm going to elaborate on the Phoenix, Australia NHMRC approved publication from June 2020 on cPTSD. The research on PTSD treatment is longer standing than cPTSD. The standard recommended treatment for PTSD are trauma-focused treatments such as CBT, exposure therapy, and EMDR. When trauma-focused CBT is used for people with cPTSD, what the researchers found was that it helped with negative self-views, lower self-esteem, and relationship difficulties that people with cPTSD have. However, it was not as helpful with the up and down emotions that people with cPTSD can experience. Some researchers argue that for cPTSD, it is important to help the person first feel a sense of safety, manage the emotions going up and down, plus improve their skills managing social situations before diving into the more trauma-focused therapy. However, an opposing group of researchers say that this work then delays working on the real underlying trauma. Time. We need to remember that therapy takes weeks to work, and often we need to see a couple of therapists before we find the right fit. cPTSD presentations are complex. There are different parts to it. For instance, trouble with relationships, negative views of self, plus being constantly alert and on edge. The trauma with cPTSD is repetitive and often occurs at a young age, a key developmental period of a person's life. This can make it more complex to treat. Specific trauma-focused psychological interventions such as trauma-focused CBT, exposure therapy, and EMDR appear to be effective in the treatment of several of the cPTSD symptom clusters, but not all. The therapist may need to use different techniques to get on top of the different parts to a cPTSD presentation. Also, the therapist needs to be experienced and skilled enough to know which part of the cPTSD presentation to tackle first. Thank you for watching this video. If you have any comments or questions, please let us know. If you have enjoyed this video, give it a like. It helps others come across our educational mental health videos.